Understanding Insulin Resistance. Introduction. Welcome, everyone. Today, we're diving into a vital topic that affects millions of people worldwide: insulin resistance. This presentation will guide you through the basics of insulin, how it functions in the body, what insulin resistance is, its causes and symptoms, and most importantly, how it can be managed and prevented. By the end, you'll have a clearer understanding of how lifestyle choices and medical guidance can make a profound difference in metabolic health. Section 1. Basics of insulin and its role in the body. Let's begin with the foundation: insulin itself. Insulin is a hormone produced by beta cells in the pancreas. Its primary role is to regulate blood glucose levels. After we eat, carbohydrates are broken down into glucose, which enters the bloodstream. Insulin acts like a key, unlocking cells so that glucose can enter and be used for energy or stored for later use. This process is essential for maintaining balanced blood sugar levels. Without insulin, or if insulin isn't working properly, glucose remains in the bloodstream, leading to elevated blood sugar and potential health complications. Section 2. What is insulin resistance? Now that we understand insulin's role, let's explore what happens when the system breaks down. Insulin resistance occurs when cells in the body stop responding effectively to insulin. Despite insulin being present, glucose uptake is impaired. As a result, blood sugar levels rise, and the pancreas compensates by producing even more insulin. Over time, this strain can lead to serious metabolic issues. Several factors contribute to the development of insulin resistance. Genetic factors. Some individuals inherit genes that make their cells less responsive to insulin. Excess body fat, particularly abdominal fat, which interferes with insulin signaling. Physical inactivity. A sedentary lifestyle reduces insulin sensitivity. Chronic inflammation. Persistent inflammation disrupts cellular communication, including insulin signaling. It's important to distinguish insulin resistance from insulin sensitivity. In a healthy state, cells are insulin sensitive. They respond well and absorb glucose efficiently. In contrast, insulin resistance marks a decline in this responsiveness, often leading to metabolic dysfunction. Section 3. Causes and risk factors of insulin resistance. Let's take a closer look at what increases the risk of developing insulin resistance. Genetic predisposition. If insulin resistance runs in your family, your risk is higher. Inherited traits can influence how your body processes insulin. Lifestyle factors. Diets high in processed foods and sugars contribute significantly. When combined with physical inactivity, the body's ability to regulate insulin deteriorates. Associated medical conditions. Obesity. Excess weight, especially visceral fat, is a major contributor. Hypertension. High blood pressure often coexists with insulin resistance, compounding cardiovascular risks. Polycystic ovary syndrome, POS. This hormonal disorder is frequently linked to insulin resistance, affecting reproductive and metabolic health. Section 4. Symptoms and health implications. Recognizing the signs of insulin resistance is key to early intervention. Common symptoms include fatigue, persistent tiredness due to inefficient energy production, increased hunger. Cells aren't absorbing glucose properly, triggering more hunger signals. Difficulty concentrating. Brain fog and reduced mental clarity can result from unstable blood sugar. Skin changes. Darkened patches of skin, especially around the neck or armpits, may indicate insulin resistance. One of the most serious implications is its relationship to type 2 diabetes. As cells resist insulin, the pancreas works overtime to produce more. Eventually, this compensation fails, leading to chronically high blood sugar and the onset of diabetes. Long-term consequences extend beyond diabetes. Heart health. Insulin resistance damages blood vessels and disrupts cholesterol balance, increasing heart disease risk. Stroke. Elevated blood sugar and inflammation heighten the risk of clot formation and vascular damage. Kidney damage. High blood pressure and poor glucose control impair kidney function over time. Section 5. Prevention and management strategies. Fortunately, insulin resistance can be managed and often reversed through proactive strategies. Dietary recommendations. A balanced diet rich in whole foods supports metabolic health. High fiber intake improves insulin sensitivity and stabilizes blood sugar. Limiting refined sugars helps prevent insulin spikes and glucose overload. Exercise and activity. Regular physical activity enhances muscle glucose uptake, improving insulin sensitivity. It also reduces body fat, particularly visceral fat, which is crucial for reversing insulin resistance. Medical interventions and monitoring. In some cases, medications may be prescribed to support blood sugar control. Regular monitoring of blood glucose levels helps track progress and adjust treatment plans effectively. Conclusion. Understanding insulin resistance is more than a medical concern. It's a call to action. Through informed lifestyle choices and medical support, individuals can take control of their metabolic health. Whether it's through diet, exercise, or ongoing monitoring, every step toward balance makes a difference. Thank you for joining this journey into the science and strategy behind insulin resistance. Let's continue to prioritize health, knowledge, and proactive care.